Welcome to the first installment of our Road to Medicare series. We are going to be providing some educational videos here to kind of help you go on this road to Medicare. The first step we're going to talk about today is Part A and Part B. You might be questioning, when to enroll. What is Part A, Part B? We're going to address those questions here today. So let's get right into it. What is Medicare? It's a federally administered health insurance program for people who are 65 years of age and older. You must be a legal resident of the United States, or it is also for folks that are under age 65 with certain disabilities, and also for folks of any age that have end-stage renal disease or Lou Gehrig's disease. Medicare is administered by the Centers for Medicare and Medicaid Services, aka CMS, and CMS serves the public as a trusted partner and steward. So they are the ones who are responsible for the Medicare health insurance program, as well as the Affordable Care Act program also. So Medicare is administered by the Social Security Administration, which we're going to talk about a little bit more later. So stay tuned for that. A lot of folks confuse Medicare with Medicaid. That helps pay medical costs for lower income individuals and things. There are some people who may be dual eligible for both Medicare and Medicaid, and there are some special programs that are available for those folks. We will talk more about that in a separate video. So we're going to keep moving here. I want to first just talk about Medicare Part A and Part B, because that is the gateway really before you make any other Medicare decisions, whether you want to go Medicare Supplement or Medicare Advantage. We have to have Part A and Part B. So I'm going to talk about Part A and Part B, what it covers, because it provides a baseline of coverage. And whether if you're in Medicare Supplement, that's going to provide a foundation that the supplement's going to fill in as far as the gaps of Part A and Part B. Or if you're going to go Medicare Advantage, that is simply going to be actually an alternative to original Medicare Part A, Part B. So we'll talk about this as the gateway here. So Part A is your hospitalization coverage. You will have gotten Part A for free if you've worked for more than 10 years, aka 40 quarters, and paid into the Medicare system. You've probably seen the FICA taxes get deducted on your pay stub. That is the Medicare and Social Security tax, and that is going to prepay your Medicare Part A as long as you've paid into for more than 10 years. So what does Part A cover? It covers inpatient hospitalization. So if you were admitted to the hospital, it's going to cover that for more than a 24-hour period. It also has a small element of skilled nursing facility coverage, which we'll go into more detail here in a minute. Home health care. If you're unable to make it to doctor's appointments and things like that due to disabilities or health conditions, Medicare Part A will help cover a home health care visit, which would be assigned by your primary care physician. And it would also cover hospice in that situation and blood transfusions as well. So, when do you enroll in Part A? That's a big question for a lot of people. So I would say that Part A enrollment depends on a couple things. Number one, you want to be aware of a couple things. If you're contributing to a health savings account, going on to Part A is going to make you ineligible for contributions to that health savings account. So that's a big thing that people don't realize, and we see that sometimes that can cause over contributions or excess contributions as they're called, and you have to remove them. That's not a situation for everybody, but I wanted to address that because it is something that's common that we see. If you're already receiving Social Security prior to age 65, you will be automatically enrolled into Part A and Part B for that matter. So if you are not receiving Social Security and you're not contributing to a health savings account, you can likely enroll into Part A 3 months prior to your 65th birthday, and you would do that via the Social Security Administration's website at ssa.gov. You can do that there. We'll give you more details on that if you want to work with us. We'd be happy to guide you through that, and help you to really determine when to enroll in Part A and how to do it. So what are the costs associated with Part A? So Part A does have some deductibles and copays depending on how long you would be in the hospital for. There is no premium for it. Like I said, it is free. You prepaid into it through your working years. There is a deductible that is recurring. If you're in the hospital for up to 60 days, then you have a $1,600 deductible, that for each individual inpatient stay. as long as they're not considered, a continuous stay. If you are in the hospital for more than a 60-day period, Part A would cost you $419 a day, for 2026, and through days 91 through 150, $838 a day. Now, after 150 days, there's no coverage beyond that. So that can rack up pretty quickly if you don't have any other coverage beyond that. Now, remember, Part A and Part B is a baseline of coverage. Any choices beyond this would help to reduce or eliminate some of these costs here. So stay tuned for that in our subsequent videos on Medicare Supplement or Medicare Advantage. So in addition, Part A provides skilled nursing facility care. So Medicare will pay for the first 20 days of a skilled nursing facility visit. After that, days 21 through 100, there is a $209 per day copay that you are responsible for. If you get past 100 days, there is no coverage. So that's an important thing to know, because some people think that Medicare would cover that, and it does to a certain extent, but not after that. You are on your own. It also, like I said previously, it does cover the home health care at 100% if you are unable to make it to your doctor's appointments for health and or disability reasons. If you have any questions on Part A, you feel free to reach out to us. We're happy to address that. We do want to talk about the next segment of Medicare, which is Part B. And really, Part B, when to enroll in that, some people will enroll in Part B at 65 if they don't have any prior coverage. What we see a lot of times here is that folks that want to continue to work past age 65, they're going to be on an employer plan. And depending on the size of that employer plan, that really dictates when you want to enroll in Part B. So if your employer group is more than 20 employees, your coverage with that employer group is primary. And you can delay Part B indefinitely because that is considered creditable coverage, and you don't have to go on Medicare fully at that point. So if your employer group, however, is less than 20 employees, then Medicare would be primary, and we have to go on Part B, and you can use your employer coverage as a supplement, or we can go on to a Medicare 100% at that point. And if you wanted to reach out to us, and we can help guide you through the whole enrollment process. For now, let's just talk about Part B, and what does that be is going to be the bulk of your medical care. When you go to your primary care physician, a specialist, any nurse practitioners, things like that, if you have an outpatient procedure, if you have any outpatient treatments or testing, things like that, if you need any type of wheelchairs, walkers, diabetes supplies, durable medical equipment, that's going to be covered by Part B as well. It does cover your preventative care and services, so your yearly physicals and things like that under Part B. And lastly, the emergency room, urgent care, emergency transportation like an ambulance, that's also under Part B. So I know that we talked about Part A being hospitalization, but Part B does cover that emergency room visit only. Okay. So how do we enroll in Part B? You have an initial enrollment period, which is when you first go on to Medicare at age 65. You have a 7-month window that exists. 3 months prior to your birthday month covers your birthday month, and then 3 months after your birthday month. You are eligible to sign up in that 3 months window prior to that 65th birthday. Now, if you are delaying Part B because you're going to continue working past age 65, there's a little bit of a different process. You have to get a form called CMS L564. That is the employment verification form, and basically that's your employer's stamp of approval. I shouldn't say stamp of approval. The CMS L564 form is basically your employer's verification that you've had creditable coverage past age 65, and that would help you avoid any penalties for Part B. So now, again, if you are already receiving Social Security at age 65, you will be automatically enrolled in Part B as well. So like I said, when you think you're going to be going on to Medicare, we can help guide you with the appropriate enrollment period for Part B. This is just a quick chart of when are you going to sign up for Part B and when your coverage will start. So this is mostly for folks that are, in that initial enrollment period at age 65. So if you enroll in the 3 months prior to your age 65, then it's going to start on the first of the month that you turn 65. So if your birthday is April 15th, your coverage will start April 1st. The only time that's different is if your birthday is on the first of the month. They will give you the month prior as your effective date. So if your birthday was April 1st, they'd give you March 1st. Now, the special enrollment period that exists for folks who are delaying past age 65, there's an 8-month window that exists after you lose your employer benefits. Now, if you work with us, we're going to try to get that timed up for you so that there's no gap in coverage. But just let it be known that you do have that 8-month window that exists in order to enroll in Medicare Part B without any penalty, okay? And then the Part B will begin the first of the month after you get that approved. So if we submit that typically a month prior, for example, if you needed a May 1st effective date, we'd probably have that Part B submitted the month before, and then once everything gets confirmed, we can get all the coverage going for that May 1st effective date that you so desired. So now, if you missed your initial enrollment period and you missed that special enrollment period, then you have to go through the general enrollment period, and that goes from January 31st to March 31st of every year, and you could incur a penalty for late enrollment for Part B. Typically, that penalty can be substantial. It's 10% of the Part B premium for each 12-month period that you go without Part B past when you were allowed to, past any valid enrollment periods. Your premium costs. So this year, the monthly Part B premium, the minimum premium is going to be $202.90. This is last year's information. So I will get that updated, but I do have that in my slide deck here that I'm going to go over with you in just a moment. So as I mentioned, 10% penalty for each 12-month period when you're eligible but not enrolled. So let's talk about these premiums. So when you're talking about your Part B premium, okay, because there is a cost to this, unlike Part A. Part A is free typically for most folks. For 2026, the Part B premiums are going to be as follows. When we're looking at what the actual costs are, Medicare does a 2-year look back. So for 2026, they're looking at your 2024 income. In 2027, they're going to look at 2025. It's a recurring 2-year look back. And the number that they're looking for your income is your MAGI, or Modified Adjusted Gross Income. That is the numbers you can probably get from your accountant, or if you're really tax savvy, you can get that information yourself. But it's going to be based upon how you file your taxes. So if you're filing an individual tax return, you're going to be in this category here. If you're filing jointly, it's essentially doubling almost the individual rates. So you can see that the base rate for this year is $202.90 per person. That's kind of the cost of entry into Medicare for most people. Now, if you're in one of these higher brackets, you're going to get what's called an IRMA adjustment. And that stands for Income Related Monthly Adjustment Amount, or IRMA for short. So what they do is they're going to take this base rate of $202.90, they're going to apply any IRMA adjustments that are applicable for that year, and that will be the premium that you pay. So now if you tell me, well, hey, Andrew, I'm retired now, my income's going to be a lot lower. Well, there is an appeal process that we can help guide you through. We can't do it for you, but you are eligible to appeal the Part B premium. If you're going from work 2 years prior where your income was much higher, and now your income's going to be lower, we often see success in folks appealing that as a qualifying life event, to be able to show that, hey, I don't have this income anymore. This was when I was working, and they will sometimes rule in your favor and reduce that premium down. So you're not stuck in that for indefinitely. It is always a 2-year look back, but you do have the option to make that appeal. Again, these are last year's costs, but the monthly premium will be $202.90 per month for 2026. Deductible is going to be $283. So what Medicare provides as part of Part B is going to be So what Medicare provides for Part B is they're going to pay 80% of those Part B related costs. So remember, primary care physician, outpatient procedures, etc. They're going to cover 80%. You would be on the hook for 20% coverage. Okay, and that can rack up. If you have an outpatient procedure, even though it might be routine, that can have a hefty bill on it. So Part B can rack up those costs, which is why we typically would recommend that you get some form of coverage beyond that, whether it be the supplement plan or the advantage plan, because that can all work in your advantage. A couple quick things. There are excess charges that exist in Medicare Part B. Now what happens there is that if a doctor or facility or anything under Part B, if they do not accept Medicare's payment, aka Medicare's assignment for a specific service, they can charge up to 15% more than what Medicare would provide. And that's it. They're limited to that. Several states, mostly New England states, have eliminated or banned those excess charges from being levied in that particular state. So you definitely want to make sure that the state that you're in, if you could be charged them. Also, there's no maximum out of pocket for Part B. So that 20% coinsurance is unlimited if you just have Part B. And I'm just going to pause again for just a moment and keep things in perspective and remember that what I'm talking about for Part A and Part B is if you just had those coverages. Some people do that. I don't recommend that, but that is something that you could do. I always recommend that you have the Medicare supplement or Medicare Advantage, which would help greatly reduce these coinsurance requirements of 20% for Part B. So I get asked a lot, what's covered by Part B? Is it dental? Is it vision? Well, no. Short answer is no. So what is not covered? Essentially, dental or dentures, your routine hearing and hearing aids, your routine vision, your eyeglass coverage, long-term care, even like podiatry and foot care, some cosmetic surgery, foreign travel is not essentially covered by that, as well as acupuncture or alternative medicine. So when it comes to what's not covered by Part B, we want to try to match up some coverage, with that would work well if you needed that. It's not a requirement to have it, but this can enhance your overall experience and your overall medical care. We'll talk about that at a different time. If you have any questions on Part B or Part A, feel free to give us a call, reach out, and we'll be able to help guide you through, when to apply, how to apply, and what your coverage options are beyond that. Stay tuned for our subsequent videos, which are going to go over the Medicare supplement, Medicare Advantage, prescription drug coverage, as well as some of the ancillary coverages as well, like dental, vision, hearing, etc. We look forward to hearing from you. Thanks. Bye.